A rare emergency alert at an emergency department. Added yesterday, now over. But this message remains.
Non-urgent, non-serious illnesses are not meant for emergency rooms.
That means for a child with an earache, pink eye, or bladder infection, go to a family doctor's office or walk-in clinic instead.
We could register you, but if we're not going to see you for 12, 14, 16, 18 hours, that's pretty much the same thing as not seeing you.
The issue in so many places, a surge in non-COVID patients, plus low staffing numbers.
When it comes to volume, we're just seeing an awful lot of it.
In Kingston, Ontario, they've capped the number of patients allowed at Hotel Dieu Hospital's urgent care centre to a maximum 120 a day. Many staff are off with the virus.
So I think we had 50 off today, and we're seeing between 10 and 20 new staff cases every day.
In Quebec City, staff who test positive are allowed to work if they can. In the BC interior, 4 rural hospitals closed their ERs over the weekend.
The big worry is that one of these days we are going to hear about the case where the closures have meant somebody did not get to care at all, and we do see it that. And we are all very frightened of that.
Her hospital in Clearwater, BC, has less than half the regular nursing staff. That's something Quebec's nurses union says it's been warning about for years.
It's not a shortage, it's a hemorrhage of nurses. And when you have a hemorrhage, if you're in healthcare, you got to put pressure on the wound. And as long as we're treated miserably, nurses are going to keep leaving.
The hope is that a rising 7th wave won't bring an unmanageable rise in hospital patients. Lorenda Redekop, CBC News, Toronto.